We are back on the Credit Human pregame show. It's time for today's medical feature. Team Dr. Kenneth-Nwosa joins us, and there is a technique that's been out there in the medical field to help speed up recovery for a number of years. It's called PRP. Tell me what that means.
Yeah, so platelet rich plasma is an innovative therapy and approach to help with aches, strains, tendinitis, different types of ailments to speed up recovery and also provide a safe and effective way for the healing process to occur.
All right, so you take somebody's blood from their arm and then you re-inject it into it after it's spun in a centrifuge to get all those platelets running around. I guess oxygenating the blood, correct?
So what's happening is that as we take your blood and we put it in a centrifuge, it gets all those good products that are part of your blood that promote healing, and we inject it into an area that is not healed, an area that is hurt, or an area that is damaged. And what that does, it brings a high concentration of that substance to the area that is in need, and it promotes healing and restoration in that.
There are a lot of parts of the body where blood naturally flows to in abundance, and then there's areas where it doesn't. And sometimes the areas where it doesn't are the ones that seem to take the longest to heal.
Exactly. So there are different areas that can be called watershed areas that can have some problems with the natural blood flow to an area. So sometimes it may be necessary to augment a treatment plan with PRP injections.
When did this technology become available, and what was the science behind it that somebody said, wow, this is what's going to help us speed up recovery?
So it's been available for a couple of decades, but it's now becoming more and more popular as we are seeing the benefits from it. We are continuing to test the different types of concentration, whether or not it should be leukocyte poor, leukocyte rich, or even platelet poor plasma. But we are going to continue to study it. We're going to make sure that the use for it is going to be beneficial for the patients.
I've had it done a couple of times. Once when I was asleep, once when I wasn't. Now, I can tell you it's painful, but it does work.
Yeah, that's the one thing. So it is painful sometimes, but you always want to speak to your physician to decide what is the right regimen for you, whether you need to be asleep for the procedure or you need to have pain medications before and after the procedure.
Well, I had it after the surgery before they woke me up, and then once in the office when they needed a little bit more. Is this something that you need to do more often than not? Is it becoming kind of the standard in especially ligament and joint type injuries?
So it's becoming a great option for a non-surgical treatment for different tendinitis. For example, things like tennis elbow that has been proven to be beneficial when we look at randomized controlled trials over time. So it's becoming, we hope that one day becomes a standard of care to keep people that don't need to have surgery and just keep them in the office and treating them that way.
All right, that's Dr. Kenneth-Nwosa, team doctor for UTSA Athletics. And that's today's medical feature, brought to you by UT Health San Antonio, the official healthcare partner of UTSA Athletics. For more information, visit uthealthcare.org. We continue on the Credit Human pregame show coming up next. This is Roadrunner Football from Learfield.